Hi, Dr. Starsiak here again. And in this video, I'm going to answer the question, what is osteopathy? If you don't know, you're in good company. In my experience, it's somewhere around 5% of the population in America that has some familiarity with osteopathy. To start off, many people listening to this may have actually seen an osteopathic doctor to receive care and not even know it. Most osteopaths, in fact, are practicing just like MDs practice. They could be a family doctor, a cardiologist, an orthopedic surgeon. In fact, my dad, he is an osteopath and he's an orthopedic surgeon here in Indianapolis. So we have all of the same practice rights as MDs to begin with. We learn all of the same information, and many DOs also take the same tests that MDs take. And if we, when we go on to residencies, because the vast majority of both MDs and DOs do go on to complete residencies, we take the same board tests to certify in those residencies. Research shows that we perform equivalently on on tests that look at basic medical knowledge and basic scientific knowledge in general regarding human physiology and anatomy and so forth. So what makes us different is our focus on the structure-function relationship, the body's ability to heal itself, and the unity of the body. We learn how to directly treat the body structure to resolve disorders of structure. These disorders, dysfunctions, are typically a result of trauma. It could be as far back as birth trauma, but really any sort of trauma. Generally physical trauma, but the osteopathic principles also apply to emotional trauma. So these four principles that frame osteopathy are that the body, mind, spirit are all a unit. We can't effectively help our patients heal if we don't recognize that they are a unit. We can see this in posture, for instance. If someone is very happy and confident, their posture is upright and open. If someone is feeling depressed, sad, with vulnerable, small, they'll frequently show that in their posture as well. So here we see that there is a fluidity between emotions and between structure. So you can see body and emotions are connected, and mind is also a part of that. The mental body has to do with thoughts of confidence or the thoughts that lead to sadness. And so it's all unified together, including our spiritual aspect. All of it is one. So someone practicing osteopathy will take into account those connections. And so this is where this term holistic comes in, where we look at people holistically, like spherically, at all of the inputs that they receive, all of their relationships, because they can all play a role in health or lack of health. So of course we would, like any good physician should, really, I think all MDs who are paying attention also accept that being holistic is the ideal, where we consider exercise, nutrition, relationships, environment, along with just the physiology and the medicine that's going to be prescribed. The next principle is that structure and function are interrelated, like a chair. If a chair has one of its legs broken, well, its function will be compromised. Structure and function are interrelated. So when we experience trauma and we have a change in the balance of tension in our ligamentous and fascial framework, the fascia are these sheets of connective tissue that line the body everywhere, connect everything together. They create channels for the arteries, veins, nerves, lymphatics. They help the organs slide against each other. And it's like a web of balanced tension, kind of like one of these toys. And it operates under the principles of tensegrity. So when there is a trauma that someone experiences, it will change the balance of tension. One event is really, unless it's very bad, it's typically not enough to cause a big problem. But if someone gets ejected through a windshield, well, that's all they need to cause problems. They're likely going to have headaches, back pain, neck pain. It might take a while to show up, but it pretty much always will. But usually people get multiple smaller traumas, and then eventually the body can't compensate for it, and it comes out as a symptom. Another dynamic here is you have something happen, kind of like if you hit a pothole with your car, and then you may have an acute discomfort that goes away in a couple days, but then there will be a chronic condition that arises later, much like if you misaligned your car by hitting a deep pothole, that then later you might have problems with how the tires were wearing because of the misalignment. So it's not the tire's fault, it's that misalignment that occurred from that jarring, that shocking event. So structure can be distorted, and then if you distort the structure, it will affect the functional elements of it. So a joint, if the ligaments are not equally balanced, will not stay in its neutral position. It will be shifted off of its ideal neutral, so it will experience more resistance to motion. It will be less efficient. Muscles will be trying to tighten up to bring it back into its normal position. That asymmetric muscle tightness will start to create pain in muscles. Extra tension in regions of fascia will create pressure upon nerves or traction upon nerves, and then you can have incomplete muscle activation. You can have just sensitization of the nerves to pain. You also are going to get poor lymphatic return in areas where either the fascia is too light or too loose because it won't support the normal lymphatic function. So you get a buildup of inflammation. That buildup of inflammation can lead to sensitization of the nerves to pain, so the area becomes more painful. You won't drain venous fluid as well, and it can create some resistance to arterial blood flow. As along with the dynamics of the nervous system regulating blood flow. So if the nervous system becomes impaired by a structural disorder, then it can affect blood flow to that area. When you have spinal level changes, the nerves that leave the spine to innervate certain organs can be affected. These are called somatic visceral reflexes, where a disorder in structure in the body structure, the frame, will then lead to downstream effects in organs. So, it could lead to gastritis, constipation, diarrhea, different sorts of issues can be associated with that. It can go the other way as well. An organ dysfunction can also create a change in structure, viscerosomatic reflex. The next principle is the body has the ability to heal itself. You cut yourself, it heals, right? We will tend towards healing if we allow our body to. If you keep that cut clean, if you keep it from staying too wet, and you keep it safe from infection, then it's going to heal. But if you're always digging in, manure or something with a cut hand, well, it's probably not going to heal. The same thing is true for disorders of the body structure. If we rest, we take it easy, the body will heal it. In cases where there's more extreme injuries, the body can't do it on its own. It's just too stuck. It needs an external force to help move it free. But other dynamics are, okay, if relationships need to be good, so someone's emotions are positive, so that healing force is fully available. If we're always angry or depressed or frustrated or anxious, then we're really going to lock down the flow of that healing potential. We need to have regular physical activity because the body's setup anticipates physical activity. It helps with all sorts of different functions. So that we need to have that in place to help maximize our healing potential, as well as appropriate nutrition. We can't be taxing our body with all of these hard to digest, low quality foods and then expect it to really be able to bounce back from insults and injuries. And the last principle states that to engage with facilitating the healing of a patient, and I say facilitating a healing of a patient because it's not the It's not the physician that heals the patient. It is that patient's indwelling nature of their body, mind, spirit that tends towards healing, that does the healing. The physician facilitates it. We get those things out of the way which block it. So in order to facilitate this healing, we need to follow those three principles. So basically that fourth principle is just acknowledging those first three principles. So someone who is focusing on what makes osteopathy different from allopathy is typically doing structural work. They're typically working with the body structure to resolve these dysfunctions using a whole suite of approaches. Really, it is the most comprehensive system of body work that is out there. Other systems of body work have parts of what osteopathy has, but none of them have the fullness that osteopathy does. Much of what was within osteopathy has since leaked out and kind of nurtured other types of work. Chiropractics started 3 years after the first osteopathic school. The founder of chiropractics describes his first treatment, not establishing a school, not teaching other people, but the first time he treated someone was 3 years after the first osteopathic school started. And he lived 1 hour from that school, and there are records of him communicating with the founder of osteopathy. Structural integration, created by Ida Rolf, directly acknowledges osteopathy as its inspiration. You find a lot of DOs have taught physical therapists, and so physical therapy now uses a lot of these aspects from osteopathy. Cranial sacral therapy is just a DO taking the work of another DO. Back in the 40s is when the original DO, William Sutherland, created or discovered the principles that underlie what we call osteopathy in the cranial field. So John Upledger took those realizations, those discoveries, and he created a kind of intellectual property around it and changed the name, called it cranial sacral therapy, and then taught it to other non-osteopaths. So osteopathy has really been the source of a lot of these other approaches to healing and body work. So that's osteopathy in a nutshell. We started being focused on the body structure and manual work, and then after the founder died and the approach MDs were taking became more and more evidence-based, because back when osteopathy started, MDs were treating with mercury, opium, brandy, cocaine, cannabis, without really any evidence. Maybe all of those could have some benefit in some places. I mean, mercury is going to be really, really, really limited in what benefit it could have. But they were just doing things because that's what people always did, and they were actually accelerating the death of their patients. So as evidence-based medicine really blossomed within the MD world, DOs didn't resist any of that. We incorporated this full range of treatment where if you consider good pharmacology, it's based on the structure-function relationship. You have these receptors, and these receptors have a certain structure. And so if you have a certain molecule that fits that receptor, it'll create an effect. So therein is the structure-function relationship. And then how you apply that is going to be different. Like if someone has pain and you just give them opiates, well, that's not an osteopathic way of thinking, because we're not solving the pain, we're just covering it up. And we're covering it up in a way that's ultimately harmful. So these evidence-based approaches were adopted by osteopathy, and so surgery, pharmacology, the whole range of approaches now is taught within osteopathic schools, and you'll find DOs doing all sorts of medical practices. So if you have any questions about osteopathy, or you're interested in receiving treatment, please give my office a call, 317-410-9978, or send us an email, info@drstarsIak.com, or check out my website, www.drstarsiak.com. Thank you very much, and please subscribe to my channel. Check out my other videos.